All right, well, I think we're 2 past noon, so we can get started. Thank you everyone for joining us for the webinar Clinicians as Advocates, Preparing for 2023 State Legislative Sessions. A few housekeeping items before we begin. We would greatly appreciate it if you can keep yourself on mute unless you're asking a question. This will just cut down on background noise. And speaking of questions, while we do have time allotted at the end for a Q&A, please don't hesitate to ask anything during the presentation. You can just unmute yourself or pop something in the chat. And finally, this webinar is being recorded, so folks who can't join with us today still have a chance to learn. So with that, we can begin. My name is Samantha Berg, and I'm the manager of state advocacy at the Society for Maternal-Fetal Medicine. I know we have a number of folks joining who are not SMFM members. So for those who don't know, we are a nonprofit association with more than 5,500 members, our core membership being maternal-fetal subspecialists. We are dedicated to advancing optimal and equitable perinatal outcomes for all who desire or experience pregnancy, and our work falls under 3 overlapping categories: advocacy and partnerships, member engagement and support, and knowledge, education, and research. So under our advocacy and partnerships bucket of work, we have a relatively new initiative, our State Liaison Network. This is a member-led program that focuses on state-level advocacy and the implementation of state-based public health programs. We aim to harness the power of clinician leaders in each state to provide intelligence and really serve as our ambassadors and advocates. So we've worked with our SLN members on a number of advocacy activities, including drafting legislative testimonies, submitting reports and letters of support, and more. And we'll get a little bit more into that later in the presentation. So for today's webinar, we're going to start by reviewing state abortion access post-Dobbs before diving into what we expect from 2023 legislative sessions. We'll then close by discussing opportunities for advocacy, leaving time at the end for a Q&A. So with that, I am beyond excited to introduce our guest speaker today, Elizabeth Nash. Elizabeth is the Principal Policy Associate of State Issues at the Guttmacher Institute, where she works on a wide range of reproductive health policy issues, including abortion, contraception, insurance coverage, pregnancy and maternal health, fetal issues, refusal clauses, youth and sex education. So no shortage of work. And all of this work contributes to the Guttmacher State Laws and Policy series and updates of state policy developments. Elizabeth received her undergraduate degree from the College of William and Mary and earned a master's degree in public policy from the George Washington University. So with that, Elizabeth, I turn it over to you, and thank you so much for joining.
Thank you so much for having me. Yeah, it's always funny when you listed all of that really things. So there's a lot to do. So thank you. It's really a joy to be with everybody today. We're going to talk a little bit about kind of where we are and what we're expecting for the next legislative sessions, and I really welcome questions. I try not to speak totally in legislative language, but if I veer into that world, please, let me know if something doesn't make sense. It may not make sense because it's not understandable. I also wanted to be clear. So anyway, let's get started. So we're going to talk about exactly what the slide says, a little bit about what's been going on next slide. So
Elizabeth, I'm just going to stop you. I think you're breaking up a little bit for folks.
Oh, I'm sorry. What do here? It's sounding now.
Try again. Say something again.
How is it sounding now?
You're still breaking up. I can hear you, but if others can't, maybe chime in the chat.
How did that help?
That did not help for me. But is anybody else having issues? Because if it's just me, we can keep going.
No, I'm also having issues hearing.
Yeah, it's breaking up. I agree.
Yeah, maybe if you want to call in on your phone. And everyone can take this time to look at the beautiful map that you put together for this presentation. While Elizabeth is working on her audio, folks, feel free to introduce yourself in the chat, say where you're coming from, anything else you'd like to share with other attendees.
Okay, how is that? Oh, no. Okay, how's that?
Perfect.
Super.
Crystal clear.
Okay.
Sorry
great.
about that.
Okay. My apologies. My apologies for that. I'm sorry that hasn't happened before. But we found a solution. So, okay, so let's start with the slides. So we're now looking at this map that I wanted to just sort of ground us, right? Give us a little bit of lay of the land on where we're seeing abortion bans right now. And right, it's basically a quarter of the country where we're seeing these bans. We have 12 states where bans are in effect, along with 2 states, North Dakota and Wisconsin, in kind of like the dotted states, where abortion is just unavailable because there are no providers right now, right? In North Dakota, the one clinic moved to Minnesota, and in Wisconsin, the clinics are not providing abortion services because there is a real concern around whether or not the pre-Roe abortion ban is in effect or not. And then we have, Georgia, Arizona, and Florida, where we have gestational bans in effect. Now, if you look at all of the potential women of reproductive age, you're looking at about 19.2 million women of reproductive age living in those states. And of course, the total number impacted by these bans is higher when we add in transgender individuals. Unfortunately, we don't have a good estimate for that number. Otherwise, I would have given you a more solid figure. But just to say, that is getting upwards to well over a quarter of the 75 million women of reproductive age in the country. So, and to sort of make a note here, right? This isn't a really static map. So if we could go to the next slide, please. So on this map, what you're seeing, all these little X's are really about all the court cases. So we have litigation pending across the country in some states, right? Look at Utah and Wyoming, for example. The courts have blocked enforcement of abortion bans. But in other states, it's been more of a back and forth. Thinking about Ohio, where the 6-week ban was in effect for a couple of months from late June to mid-September. And now, that law has been blocked by the courts. But it feels like, you're sort of on this teeter-totter where the ban could be in effect for a series of weeks and then it's not for a series of weeks, right? So it's this back and forth. But just so seeing all of these cases that are moving ahead, and we don't know how they will be resolved, right? They're generally in state courts where we haven't had a lot of litigation around abortion bans or abortion at all. And so this is really new territory legally. And the kinds of arguments that are being made are using these state constitutions, right, that just haven't been tested. So just to say, there's a lot going on beyond sort of, which states have bans in effect and which don't. And that brings us to sort of the next slide where we're in sort of thinking about this presentation. Sam and I were thinking about the definitions of abortion and how that impacts what is actually being banned and what does it mean for providers and litigators and the whole gamut of people invested in abortion access. And so I pulled a definition of one of these states. Now, these definitions vary, but this one has some of the elements that we see in a number of the definitions. So, and so I paired it with the definition of unborn child, because that definition is very routine in these bills, and is one that's pretty standard, right? So the unborn child definition is about, really trying to start personhood at fertilization. Sort of the whole idea of pregnancy starting at implantation kind of gets sidelined in this back and forth with the law. So they try to start personhood really starting at fertilization for purposes of the abortion law. And so then the definition of abortion, right, then has all of these ways of and verbs and things dealing with how to end pregnancy, right, using instruments, medicine, drugs, right, anything else to end the pregnancy, and right, and refers back to this unborn child. So talking about starting from fertilization to wherever the pregnancy has gotten. But then there are also often a couple of exceptions, not in all of these definitions by a long shot, but in a number of them, where you're talking about spontaneous abortion or ectopic pregnancy. This is something we see probably about half of the definitions, but it just having that in law really isn't enough to have full protection for any of this care for you all, for providers. And so if we move then to the next slide, where we see the definition of pregnant, we start to see sort of changes in how pregnancy is defined. Often pregnancy hasn't been defined in state law, and we're seeing it coming up more and more, and they're trying to define that again, starting at fertilization. But it also applies, I probably should have underlined this, throughout the entire embryonic and fetal stages. And so it does raise some questions about selective reduction if the pregnancy is supposed to be in the uterus starting at fertilization. And so it raises some questions about IVF. Anyway, and then sort of because we had no better place to put it, I wanted to mention affirmative defense. There are a couple of the states with bans that have this thing called affirmative defense written into them. And the general idea I tried to sort of write out here is that a person commits something that would be illegal, except the facts of the case ensure that it is legal. And so what is happening here is the idea that in some of these states, if you provide an abortion under the exceptions, that you can still be prosecuted. And then you have to provide this affirmative defense that in fact you provided this abortion under the criteria of the exceptions. And the problem with this, as you might imagine by the definition, it means that someone has been prosecuted for providing an abortion under the very limited exceptions within the law, such as life endangerment or lethal fetal anomaly, as two examples. And then, so they're being prosecuted, and they have to prove that the prosecution is unwarranted. And this is, this is terrifying, right? This is not only at the very least hassle and lawyers and court fees and that sort of thing. If you aren't able to prove that you've met the letter of the exceptions, right? All of these penalties would apply to you, right? These felonies would come into play, loss of license, right? So these affirmative defenses have been talked about by abortion opponents as a way to allow some access when clearly they do not. So wanted to flag that. And then I wanted to move us more into the positive side of what has been going on in such a difficult past 6 months. So if we can go to, right, we're at abortion protections now. And what we see here is that we're looking at the states in the past 2 years that have adopted protections for abortion. And you're really looking at this point, going on to about almost half the states. We're looking at about 18 states here that have adopted protections on abortion in the past 2 years. And many of these states have adopted protections in both 2021 and 2022. And we're expecting them to, to add more protections in 2023. Now, what have they been doing? So, because you can see in this next chart, they've been doing a lot. And some of it has been slow out of the gate after bills have been signed, right? So like some of these state funds to help pay for abortions, seeing the funding moving from the legislative side into the hands of providers and patients, and helping to build capacity, has been slow. And some of that has to do with just bureaucracy but hopefully things will get moving very quickly soon. But you can see that these are the first 5 states in decades that have actually had a fund to help pay for abortions. Oregon was the first this year, starting off with $15 million for infrastructure support and helping people pay for care. And other states have filed suit. And so, we've also seen states look to expand coverage for abortion, right? 2 new states with Maryland and New York, but California amended their law so that coverage would be provided without cost sharing. And then, we're seeing how these states are trying to ensure that there's a wide range of providers for abortion, adding in statutory protections. I'm going to skip shield laws for a second, come back to it, but also looking to make sure that going in and out of clinics, people are protected, whether they're patients, staff, providers, or the HVAC repair person, right? Trying to make sure that they're not harassed. And then we're seeing training for abortion, where some states are putting in support for that because they're recognizing that we need a broader pool of providers and more training opportunities. And of course, right, this November, we saw constitutional amendments adopted in 3 states, the first states ever to explicitly add in abortion protections in their state constitutions. And that's been the typical way people have talked about these constitutional amendments. But just to say that those amendments are really about reproductive freedom. So they're broader than abortion. They apply to pregnancy, they apply to contraception, sterilization. So they're really more about bodily autonomy than simply about abortion. But abortion was key and kind of a real motivator for these amendments. But let's go back to shield laws for a second. These shield laws, we saw the first one come out of Connecticut earlier this year, and then we've seen pretty much a quarter of the states follow suit. And some of these have been adopted through the legislature and the governor signing a bill. Some of them have been through governor's executive orders. And essentially where they've started, they've been growing kind of and morphing over time. But where they started was really about providers and trying to protect providers from being prosecuted in restrictive states. So the idea is, if you're in Connecticut and you provide care to a person coming from Louisiana, that Louisiana wouldn't be able to reach you in Connecticut. The state government wouldn't help. The state government of Connecticut wouldn't help Texas prosecute you, right? They wouldn't help in any investigations. They wouldn't extradite you, those sorts of things. And we've seen these laws grow over the past several months to include things like, trying to ensure that the medical licensing boards won't take action against you if you provide an abortion in a banned state or are penalized for that. Or medical malpractice your rates can't go up for example, and then also taking more steps to provide protections for patients. These laws are reaching into data privacy, for example, and where we're anticipating we'll see more change in these bills is around how they protect abortion funds and practical support organizations. And I'm sure we'll see as bans, are in effect and how people are relating to them, more protections put into these shield laws. And so these shield laws do serve a purpose, but it's a little bit less tangible, perhaps, than say an abortion fund, or, for example, like New Mexico's identifying $10 million to build a clinic. It's a little more behind the scenes for most people. So those are the kinds of actions that we saw this year. Now, if we can move to the next map. Now, on this map, we're really seeing bans and protections together, because it's like we showed one map at the beginning, and then how do the protections kind of overlay with that, and what else might be happening? And so so it's kind of pretending that the 14 states where abortion is unavailable is pretty static, and asserting that the protective states are protective. That leaves us with a series of states where we may see action on bans in 2023, either around the court cases, such as in Utah and Wyoming, but we're in Indiana, but we're anticipating more action around abortion bans, particularly in Nebraska. Ohio has been, there's been rumblings around an abortion ban in Ohio. Thinking, seeing and watching what has happened in South Carolina, where 3 times the legislature has tried to ban abortions and Dobbs, and they haven't been successful, but concerned that they will get their act together and pass an abortion ban in 2023, right? There's been some back and forth in the political sphere in Florida, right? They have a 15-week ban in effect now, and wondering, will they try for an earlier ban, right? We've certainly been hearing that that's a distinct and very real possibility. Might they have a 6-week ban or a near total ban? That is a deep concern. And then, in Arizona, things may be a bit better in the sense of, the statewide offices are now in the hands of abortion rights supporters, but the legislature is still very, very conservative. So concerns about there. And you may be wondering why Virginia and North Carolina are in gray rather than yellow. In Virginia, we are anticipating and I say we because I grown up in the Commonwealth and I live there now. We are anticipating a 15-week ban to be introduced. It is in anticipating some political back and forth, but really hoping that at the end of the day that it fails. So there's that. In North Carolina, there's real concern around what might happen, but it's also kind of murky. The legislature did move significantly further to the conservative end after these elections, and so did the North Carolina Supreme Court. But there were no elections for statewide office, and both the governor and the attorney general support abortion rights. So that murkiness meant that it didn't get that yellow, the yellow color on it. So just saying that there are some things that are happening, and that we're anticipating a lot of action coming up in 2023, and so to move us there, if we could go to the last slide, so on this slide, really, what are we looking forward to in 2023, or looking toward? Not all of it are we looking forward to. Really, a lot of the same things. So anticipating bans, right? Thinking about Nebraska, possibly Florida, South Carolina, Ohio. Restrictions beyond bans. And by that, thinking about the states where abortion has been banned. What kind of policies are these legislators thinking about that would make it even harder to get care, right? So there are businesses, right, across the country that when Dobbs came down, they said, look, we will put aside a fund to help our employees and their dependents get abortion care if they reside in a banned state, right? We're anticipating that states may try to, the restrictive states, the states where they have abortion bans in effect, they may look to pass laws limiting what these businesses can do around supporting their employees and dependents on abortion care. Some states may be looking to adopt fetal personhood laws. And these are the laws like what is in Georgia right now and has been allowed to go into effect, that for not only the abortion code, how we were talking about the definition of unborn child and pregnancy and abortion, right? Everything stems from fertilization. That would essentially apply that across the entire code. And what does that mean for other health care? That sort of thing. So trying to really adopt sort of much broader fetal personhood laws that could even much more interfere with access to pregnancy care and contraceptive care, along with various changes to all other kinds of laws, including things like inheritance laws. Who inherits if one of the persons who would be inheriting is pregnant, for example. So these fetal personhood laws have a broad reach. Thinking about medication abortion, right? How might states further attempt to limit access to it, right? We've seen states that have tried to ban mailing of pills. Several states have those laws in effect. It's not clear how enforceable they are, but we're going to be watching what is happening around the law on medication abortion very closely. And then reducing access for young people is a point around, what could states do beyond abortion bans to limit access to abortion and reproductive health care for young people. For some reproductive health care, it may be requiring parental consent for like STI testing and treatment, pregnancy care and contraception. For abortion, it may be looking to adopt laws that require parental consent if a young person is going to leave the state for care. So they're just, young people are in, sort of have a particular issue, have some particular issues here. And then for the protections that could be put in place, right? It's a lot of seeing more of what we saw in 2022, but going beyond that to once those policies are in place around shield laws, funding, support for infrastructure, right? Building provider capacity, where do you see gaps? Right? Like, for example, in a state that has, public and private insurance coverage of abortion, has abortion clinics somewhat spread out across the state, has a decent public transportation system, what kind of gaps are there, right? There's going to be continuing need to support people's funding. We will need more support for transportation. We will need more support for childcare. All of these things. California is one of the states that has been sort of really engaged around having progressive policies around abortion and then filling in the gaps once they see how their policies are actually being implemented. And I anticipate that you'll see some other states going down that path. And so with that, I close and I will turn it back over to Sam.
Thank you so much, Liz. We actually have a question in the chat for you.
super.
Someone asked, are there any other shield laws as protective as Massachusetts?
Oh, Massachusetts is really the gold standard now, isn't it? California's comes close, but one of the things about the California law is that it's like it's adopted and then they go back and they revise it like within the same year. And so I think a lot of people are going to be looking to what Massachusetts did to to see how they can make those similar changes in their own states. And I would say that, one of the things where we really are anticipating is the abortion fund protection, practical support protection, because many of those groups are supporting people who are coming from out of state. And so trying to ensure that there are protections for them, and thinking about consumer protections and data privacy, and getting into some more of that. But no, really the Massachusetts one is really built on what we were starting to see in earlier states. So thank you. Yes. Thank you for raising Massachusetts up.
Well, thank you so much, Liz. I, really appreciate you joining us and providing that really robust overview of post-Dobbs policies and what we expect from 2023. So thank you. So moving on, I know it can be really overwhelming to take all of this in and turn our passion and anger and frustration into action. But fortunately, there are a number of ways to advocate for abortion access. So before we jump into that, I'd love to just hear from you first. When you hear the term advocacy, what comes to mind? And so I'm going to put the whole link in the chat so that everyone has a chance to respond, and your answers should pop up on screen. So this can be anything from types of advocacy to things that excite you about advocacy to things that worry you about advocacy. And I'll just give everyone a few moments to think, ruminate, and respond. It's also very possible that a lot of nothing comes to mind. There we go. Leadership. Absolutely. Staffers. I'm assuming maybe that's legislative staffers. Absolutely. Very critical to be kind to legislative staffers, especially since those are likely the people you're going to be talking to when you set up meetings with your legislators. What else? Stories. Stories are really important. I think, especially as clinicians and healthcare professionals, it's easy to want to use data, and data is very important, but it's those stories that really connect folks and, bring it back down to the personal level. Let's see what else. Testimony, patience, fighting. Yeah, these are all great answers. So moving on, I have one more poll. I would love to hear how you have advocated in your states. So again, this can be rallies, this can be talking to your legislator. Obviously, I will share more examples as we move on with the presentation, but I'd love to hear what you've been doing so far, and also what local or state-based organizations you've worked with. Attended a pro-choice rally, phone banking. Phone banking is really important. I know I've done it a handful of times, and cold calling people can seem really intimidating, but also gives you an opportunity to make connections with people you wouldn't otherwise have an opportunity to. Educating, ACOG. Yes, ACOG has folks in every state, representatives in every state who are advocating at the state level and really making sure that ACOG's mission exists in every state. So that's great. What else do we see? Legislators. Wonderful. All right. Well, it looks like the poll is switched over to a list instead of a word cloud. So I think that's a sign that we can move forward. Thank you again for those thoughtful comments. I really love hearing what everyone's been doing since Dobbs and likely before. But if you're on here and you don't know what to do, you're in luck. We're going to talk about some opportunities for advocacy. So before we jump into specifics, I'd love to just walk through 3 important levels of advocacy. So first, I am a firm believer that advocacy should begin in your immediate and more personal communities. So talking to friends and neighbors, using not just your expertise, but your relationships to explain the importance of access to care. Beyond those personal communities, it's also important to advocate at your institutions. So this is especially true if you hold a leadership position. Ensuring that your institution does not have stricter requirements than the law is critical, as is working with general counsel or other non-medical staff who may be setting policies without a full understanding of how those policies impact patients. Obviously, where you live and where you work, as well as your position, impact the level of power you hold and your security in being able to advocate. So, we'd never ask you to do something that could get you in trouble or have you lose your job, but do ask that if you have a level of power where you work, that you help make change in your workplace. And finally, and perhaps the main point I want to make with these slides is that advocacy should start with the policies that impact you where you live and work. So even if you're in a protective or quote unquote blue state, I guarantee there is work to be done that can not only help folks where you live, but also alleviate the burdens folks in other states are feeling. So for example, a lot of protective states still restrict abortion up to viability, and that's often defined between 24 and 26 weeks gestation. But in these states, there are still patients who need care later in pregnancy. This means that those patients have to be sent to states with no limits, like Colorado, which is not only difficult on the patients and their families, but also for the infrastructure in Colorado and similar states. So this is especially important to ensure that resources are being used wisely. So for example, the resources spent on sending someone who's at 28 weeks gestation from New York could potentially be used to support 3 folks at 12 weeks gestation from Tennessee. So all of this to say, this does not mean you can't or shouldn't advocate for your colleagues and patients in other states. But I think it's important to not point fingers at states with bans or, quote unquote, red states, and to make sure we're really doing enough in our own communities first. So with that, advocacy comes in many shapes and forms, and I like to think of advocacy in terms of public actions and private actions. So public advocacy includes many of the traditional forms that we know or hear about. This includes protests and rallies, speaking at hearings, testifying in court, talking to the media, or even writing your own op-ed, and utilizing social media to spread awareness and engage others. So our members have led a number of public advocacy actions, and I have 3 examples on the screen. So in August, we had a member in South Carolina speak at a Senate Medical Affairs hearing, sharing her experience as a provider after they passed the 6-week ban and really urging legislators to not move forward with the total ban that had passed the House. In September, we had a member in Montana who spoke at a rally urging Montanans to vote no on LR 131, which was the ballot measure that would have criminalized compassionate care for families experiencing pregnancy tragedies. And then in October, we had another member in Georgia who testified in the case Sister Song versus Georgia, which challenged the legality of the 6-week ban. We know that it was briefly overturned, but unfortunately, the ban was reinstated by the state Supreme Court just days later. Still, though, our members' advocacy in the case was instrumental. We've also had several members speak to the press this past year about the implications of bans on their ability to provide care and the reality of who is going to be most impacted by these laws. So you'll see just a few of these articles on your screen, and you can find the links to these and many others on our website under the press section. So now, if all of that seems like too much for you or not feasible, then you might be more interested in private advocacy actions, aka the advocacy that often happens out of the limelight behind closed doors. So private advocacy can be really appealing to folks for many reasons. Maybe you're an introvert and the thought of having your face and your name out in the public scares you. Maybe your institution isn't supportive of you speaking out and doesn't want you potentially representing the institution or having other people connect you to the institution. It's also possible that you're early in your career and you're afraid of retaliation from authority figures and supervisors who do not support widespread abortion access. In all of these situations, it doesn't mean that you're totally silenced. You can still pursue private advocacy through many paths. So one opportunity is to provide written comments ahead of hearings. So these are distributed to legislators and typically not read aloud to the public. Obviously, if you're going to provide written comments, you want to just make sure that that's the case because all states are slightly different. This allows you to get your point across to the legislators on the specific bill at hand without having to speak in front of everyone and potentially be recorded for state archives. You can also call or meet with legislators about specific bills, or even just connect with them and serve as an ongoing resource. This has become much easier in the digital age, especially since COVID, when everyone is meeting over Zoom. So you can, use Zoom or other internet capabilities to meet with your legislators instead of having to block off several hours or even days to go to your state capitol. And as busy clinicians, I know it's hard to fit in these meetings if you have to go in person. So this makes it a lot easier. I will say we have had a number of members who have established relationships with legislators who have historically been anti-abortion, but are increasingly unsure of their positions. And so being a private resource where neither of their names are mentioned in public has really helped to stop negative legislation from moving forward in some states. I'll also share that another opportunity for private advocacy is having one-on-one conversations with colleagues and your institution. So as I mentioned earlier, if you hold a leadership position in your institution, your voice is really valuable in making sure that your workplace at least allows you to provide care up to the legal limit and supports you in speaking out against bans. And finally, information sharing is a form of advocacy in and of itself. So we understand that you may be limited in your ability to advocate in your state based on various circumstances, but you can still support efforts by sharing what you know in an off-the-record capacity, even with press or with SMFM and other staff members at organizations. So I know for our staff, we really rely on our members to be our eyes and ears on the ground, especially since we're a small team. So hearing from our members on what's happening in their states helps us to advocate on their behalf. So with all of this in mind, you may now be thinking, okay, great, but now what? I know what advocacy options are available, but how can I really make a change in the 2023 legislative sessions? So step one, I say, is to stay alert and really pay attention to what's happening in your state. We just got a really incredibly in-depth review from Elizabeth of what to expect. So we can use that insight to set Google alerts or even follow some of the state legislators on Twitter who have been passing or introducing bills in your state legislature. And this will get you a sense of what to expect in the next sessions, specifically for your state. I also highly recommend, like I said previously, getting to know your legislators. This private advocacy is, again, a way to become a trusted resource and will give you some of the behind the scenes knowledge that the Google alerts and whatnot won't give you. Beyond this, it's also really important to build relationships with state level coalitions, campaigns, and organizations. Getting a sense of what grassroots and community-based organizations are doing is really important, especially as we're gearing up for a busy session. There's strength in numbers, as you all know, and I think both clinicians and these grassroots organizations and CBOs really have a level of expertise that the other needs. So building those connections, even if there's not necessarily a specific bill to act on, is critical, because when there is something that needs action, you've already established those connections. And lastly, don't forget to ask for help, especially if you're a member of SMFM or ACOG or other professional organizations. There's supposed to be a resource for you. I know here at SMFM, we help members write op-eds. We can help reach out to papers to get those op-eds published. We can help with written and oral testimony, whether providing edits or examples that members have presented in the past. And pretty much any advocacy action, we are here to support you and make your life easier and make sure that you're making a difference. So with that, I would love to share that we're actually putting together an advocacy action center, name pending, to help with that what now question. So we just started movement on this, so I don't expect it to be ready until the spring, but I can share that this is meant to be a centralized space where our members can easily track policy movements in their states, see what actions have been taking in those states, and really request support for their advocacy from staff. And, we'll also have resources and other materials to support that advocacy. So again, I don't have a full website to share, but I do want to share a couple new components that we're going to be integrating into this website. So the first is this policy tracking dashboard. So this is part of our internal policy tracking system. And pretty much anytime we track a bill, this dashboard updates automatically. So members will be able to see in real time exactly what we're tracking. It's also great because you can filter for different issues, for our stance, for your state, and even click on your state on the map to do that for you. In addition to policy tracking, we'll also include our state advocacy map, which is currently on our main website and showcases all our activities in the last 12 months. And again, this includes actions by members and staff. So we're hoping that as you take action in the next year, we can really fill this out even more, and would love to see a full map of green and no gray. And then finally, the last new component that we're going to be putting on this new website is a form where folks can formally request advocacy support from staff. It'll be pretty simple, just gauging where folks live, what type of advocacy they need support with, what topics, etc. And this will really just help us prioritize advocacy requests and needs and make sure that we can get to everybody and really support advocacy where you all live. So with that, I'm going to turn it over to you all for questions. I'll stop sharing my screen so that we can all see each other, but would love to open up the floor. You can unmute yourself or ask questions in the chat. Any questions? It's okay if you don't. All right, well, if there are no questions, then I'm just going to wrap up very quickly. Let me just share my screen again. So I'll just say that for anybody who is attending the SMFM annual meeting in February, we have 2 events related to advocacy. The first is our state liaison networking event. This will happen Tuesday night and is really an informal event that will give you an opportunity to meet with other clinician advocates and hopefully hear from some folks who have successfully advocated in their states this past year. And the second is the engagement event, which will give attendees an opportunity to take action right at the annual meeting. So with that, I want to thank you all for joining us. I want to give a special thanks to Elizabeth, who gave us a wonderful presentation and who is doing such incredible work at Guttmacher. In the coming weeks, we'll follow up with resources and share the link to the recording as well if you want to share. Oh, Erica?
Sorry, no, I didn't mean to interrupt you. That's why I was trying to wait till you finish. But there are 2 questions in the chat that I just wanted to draw your attention to.
Oh,
how do we, Dr. Gupta, how do we get our learners more motivated? And then from Dr. Thompson, can you share the link for the dashboard?
Yes, I will absolutely share the link for the dashboard. Actually, let me stop sharing my slides so I can pull that up. And how do we get learners more motivated? I think in my opinion, showing the advocacy that you're doing is a really great way to get people motivated. I don't want to speak for any students or residents, but sometimes it can be intimidating to want to take action and be an advocate if nobody above you who oversees you and is in charge of your education is advocating, because frankly, they may not know where you stand on this issue. So I think the best way to engage others is to do and to show that there is importance in advocating and taking action. I also think, making sure that these learners are being trained is really important. In a lot of states, they aren't training people in providing abortion care. So if there's a way that you can, get folks from other states to where you are and train them, like that will also motivate them to advocate more. Are there any other questions while I get that dashboard for you guys? Here we go. Well, if there are no other questions, thank you guys so much for the comments. Yeah. Well, with that, again, thank you so much, Elizabeth. Thank you everyone for joining. And I hope everyone has a great rest of your day. And we'll see you next time.